Good morning, guys. I hope we're all sparkly. I bumped into one of my GP colleagues in the gym today and asked him obviously how practice is going with the coronavirus, and asked him if he was still seeing patients because the country will inevitably be on lockdown soon. But medical services must continue. And it can't all be just coronavirus cases. There will be a backlog, there will be chaos. Everything that's routine is now being delayed. Till when? Uncertainty everywhere. With uncertainty comes anxiety. Now we should always concentrate on what we can actually affect a change with. And that's our immediate environment. Anxiety is a big problem in guys with low testosterone and high estrogen. We need insight, we need a sense of perspective, and this is being lost. Coronavirus is obviously very serious, but media, it's frustrating. It is being sensationalized. And the skeptics are talking about all of these conspiracy theories. And I'm not going to lie, I do love a good conspiracy theory. Because we're not 100% sure. Oh, we're 98% sure, obviously. It's a natural virus. But that 2%, it was created by the Chinese, it was created by the Americans. It just shows how disillusioned and disenchanted we are with our society. So he told me that he was still seeing the occasional patient in clinic, but obviously they were trying to see everybody remotely because we need to stay safe, social isolation, so we don't spread the virus. But we commented, the face-to-face consultation is integral to delivering gold standard care. It's why we went into medicine. I don't want to do remote medicine. I actually want to have that communication, that contact with my patient, because I want to be certain, I want to be sure that I am delivering gold standard care. And the patient needs to be confident that I am acting in their best interests. And I don't think you can do that remotely. So it's disappointing, but it's a necessary evil. So if you're not a fan of social cleansing, let's hope you're not, let's be a fan of social isolation and keep everybody safe. Isn't it peculiar? We talk about the importance of community and not the individual. And we need to come together as a collective. And we're saying to isolate each other. So if you do know somebody that may be in need of your help, offer it. Humanity. It's lacking. And nature has a way of reminding us. That way, this time, is a virus. It's been a tsunami before, so natural disasters, they remind us how insignificant we are and how lost we are, which is scary and disappointing. But with adversity, with hardships, humans, they do come together to effect a positive change. But sometimes we need to hit rock bottom in order for us to wake up. So let's wake up, guys. People have been panic buying stuff at the supermarket and popping it onto eBay at 10 times the price. This is not humanity. Shocking. So, I do feel slightly guilty having left the NHS and not offering my services. But 20 plus years I was with the NHS. It felt like an abusive relationship towards the end. I'd lost my passion. I felt as if I was simply a cog in a machine, a broken machine. And we all know the NHS does its very best to offer you a wonderful service. But it's under-resourced, under-financed, and abused. Toxic overcrowding by the entitled many. So this has to change. I used to go to work and my heart would sink. I hadn't even seen a patient. I'd walk into the hospital and my heart would sink. And it got to that stage where enough's enough. So I reevaluated, reassessed, and concentrated on a more preventative model. And that led me down the road to male hormone replacement therapy, witnessing the unmet need and the poor service that is available to people who actually have a defined diagnosis but don't receive appropriate care. Now, the NHS is not particularly interested in male hormone replacement therapy. There are lots of arguments as to why, but low testosterone is not high up on the agenda when there are, in inverted commas, more serious health issues going on, such as the coronavirus. But the NHS has to adopt a firefighting model rather than a preventative model, because it's just too far down the road. Disappointing, but that's the reality. So we need to take responsibility for our own health. And that, in part, comes down to paying for your own testosterone replacement therapy. We need to go back to the fundamentals. And this coronavirus has highlighted this. Wash your hands. My God, there are some filthy people out there who have no concern for anybody else. Me, self. This is exactly what is wrong with humanity, society, civilization. We are so far removed from nature. It is clear from all of the preventable diseases that we just lack the insight to address the fundamentals. What was the first thing to go in this crisis? Toilet paper. Give me strength, guys. I mean, it's absolutely disgusting. So, I ventured into private care because I not only wanted to deliver the best service and care possible, I also needed to do it for myself, my conscience. So it was quite uncomfortable charging people. I'm more comfortable charging people now. But ethically, morally, I'm 100% certain that I earn my money. And since everybody can only place value on something if you attach a pound sign to it, it's a necessary evil. I posted about self-medicating the other day, and some doctor posted about how it was morally wrong for me not to take over the care of people who are self-medicating. And he ended his little rant with, "I will see anybody if they pay me." Yeah, so that's not a moral discussion, that's an ethical one, and it sounds like your ethics need a little bit of reassessment. We need ethics, so it's much like doctors do have the right to not sign the abortion document. I did, because it's not my right to tell somebody else what they can or can't do with their bodies. So it might seem contradictory to say, well, if testosterone replacement therapy is helping me and I now want to be under the care and supervision of a doctor, why won't you help me? And that reason is because there is a massive divide between traditional health services and the private sector and the steroid boys stroke self-medicators. We want to improve access, we want to improve the standard of care and make it available on the NHS, because there is a place for the private sector, irrespective of whether you are receiving the same service from the NHS. People want to pay because they will get a higher standard of service for all the reasons discussed. So there is no conflict of interest here. I do want to improve access to safe and effective care, because we can always deliver a higher service or higher quality of care. So part of that is using medications in an unlicensed, off-label way. It is no secret that if you adhere to the manufacturing recommendations and prescribed testosterone enanthate, testosterone cypionate, Sustanon, all of these medications, as per the manufacturing recommendations, you will have massive peaks and troughs. And we want to avoid peaks and troughs. We want stable levels. We want a nice healthy testosterone to estrogen to DHT ratio every single day. So irrespective of how close you are to your injection, how far you are away from your injection, in between, we want stable levels, because your hormones want to be stable every single day. There's slight fluctuation, as discussed before, so there's diurnal variation, but we want stability. Your body wants stability. You will remain physically and psychologically healthy if you understand this and address the foundations of health. Can't drum this in enough. So private practice allows me to deliver what I consider gold standard care. That is achieving stable levels. Now, the most effective way of doing that is daily test SIP and HCG injections via the subcutaneous route. Does it work for everybody? No. I had a guy, or is it appropriate for everybody? I had a guy yesterday with bad Parkinson's who had pretty much unrecordable testosterone levels, and we've decided to microdose Nabido with him. So we're doing 125 every week, because he's going to have to come to surgery to have the injection, because he can't self-administer and he hasn't got somebody else that can self-administer for him. So we're not going to use HCG with him. We're going to see how he gets on and then decide further down the line whether we need to introduce, remove, So I will keep a close eye on him. But he's fascinating, because there is obviously an association between low testosterone and Parkinson's, and I'm sure he will see a positive effect from testosterone replacement therapy. not only on the negative symptoms of low testosterone, but I'm sure he's going to see an improvement in his Parkinson's. So when you prescribe off-label stroke unlicensed, you must do so understanding why you're doing it. And that is to achieve stable levels. Because we know that not prescribing like that does not achieve stable levels. So I get very irritated and frustrated when people come to my clinic from online providers. I have utter disdain and contempt for online providers because I think, in my opinion, you know what they say about opinions, everybody's got an opinion, much like everybody's got an arsehole. But yeah, I believe that they are using testosterone replacement therapy as a cash cow, and they are not acting in the best interests of the patient. All patients, according to the GMC, with complex medical conditions, and hormone replacement therapy is complex, should be seen via a face-to-face consultation. Now, I find the whole thing shocking, and I find the cookie cutter approach that these online providers provide motivated by money. 1 to 5 of Sustanon every 5 days, and then when you spike your estrogen, 0.5 milligrams of anastrozole every 5 days. I have so many people come to my clinic from online providers with these cookie cutter approaches, frustrated with the level of service and lack of care. No one at my clinic is on 125 of Sustanon every 5 days. No one. I do have a couple of people on Sustanon, and we prescribe that every other day because of the prop ester. I have discussed this before. So if you understand physiology, if you understand pharmacology, pharmacokinetics, pharmacodynamics, you understand that if you were to prescribe Sustanon, you should prescribe it every other day. Because of the prop ester, to achieve stability, to minimize your level of aromatization, to try and maintain at least that healthy testosterone to estrogen to DHT ratio. So when you get told Sustanon is a wonderful blend of esters, and it's the most effective way of achieving, and Sustanon 1 to 5 every 5 days is wonderful. I'm wonderful. That you know guy saying, I've tried them all. I've tried dailies, I've tried test sip, I've tried, and I don't know, barefaced lies. Barefaced lies. For the reasons discussed. So the reason why they prescribe 125 of Sustanon every 5 days is because they can make the most amount of profit from you guys. That is it. Plain and simple. The most amount of profit. What they try and do is they justify that dose because ampules are single use only, and so they can get away with telling you, well, you inject 0.5 and then you'll have to discard the rest, and always adhere to the doctor's instructions, and we have to adhere to what the MHRA advise. Well, you're already prescribing off-label and off-license, so your argument is invalid. Now, we had a GMC complaint which they took 17 months to compile. screenshots of TRT in the UK, and it really centered around the use of purpose manufactured multi-use vials. So what we do with our patients is we transfer, and this isn't compounding, that's an American term. So when you said that you'd spoken to the MHRA and said they're compounding medications, you slipped up, mate, because the MHRA does not use the term compounding. Or you must inform the GMC straight away. Well, the MHRA would have informed the GMC, you idiot. So we use manufactured sterile 10 ml vials. Why? Because we want to make testosterone replacement therapy as cost effective as possible. We want to deliver the gold standard care and service that patients deserve, not use testosterone as a cash cow. As you can tell, I get a bit pissed with these people because I believe they are causing harm. Why? Because with over 600 patients now, we've got about 100 that have come from online providers. And none of them, under my care and supervision, are on 125 of Sustanon. Well, I feel... So, rant over. Better go do some work. Stay safe.